If the heart is the DJ, then let's see the blood vessels, the dance floor. Everybody has to move in rhythm, right? Look, take the arteries, a high pressure, bold highways, fast movement of cars. What about the veins? Let's take the veins as a chill, low pressure hangout where people just stay, talk, relax slowly, slow movement. That's how I want you to understand the veins. Now, how about the valves? The valves, take them as the bouncers that determine who enters and who doesn't enter, right? So he knows when to stop people and knows when to allow people. That is the valves. Now, I want you to see the capillaries as the gossipers. Cha 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 cha, cha 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 cha. Talk to this person, talk to this person. You take from here, tell this person, take from here, tell this person. That's how I want you to see these blood vessels. So today we are discussing each of them one after the other. And we are going to discuss about 30 to 50 questions. These questions are not just exam questions, but they are concepts, things that will help you get a holistic idea of what this topic is all about. All right? Because this is one of the most prominent topics in your board exams. I'm talking about your college exams. I'm talking about the NCLEX. I'm talking about USMLE. Most of these concepts always comes out. This is physiology. Remember, physiology is function, function, function. And anatomy is what? Location, location, what? Location. Or if I want to baptize it, I will say anatomy is what? Structure, structure, structure. All right? So I need you to take your pen and paper and write down some of these things. Try to understand them. If I'm speaking too fast, I want you to slow down the video so that you'll be able to understand what we are talking about. Most importantly, before we start up, there are some questions I want you to write the answer in the comment section below, which I will treat at the end of this discussion. I'll just give you 1 or 2 questions to try you out, all right? Put the answer in the comment section. And mind you, I need everybody to make comments. Please, comment whatever you want to tell me, tell me. Even if that the video is good or not really good, or you want me to improve on something, feel free to tell me. Most importantly, like and subscribe, please. Thank you. Okay, so try these questions out. What is the circulatory route from the heart? Tell me. Is it the heart to the arteries, to the capillary beds, to the veins, to the capillary beds, to the arteries, to the heart? Is it the heart to the arteries, to the capillary beds, to the veins, to the heart? What is the route? We are going to discuss this later, so don't worry yourself. But I want you to, just give me your own route in the comment section below. Also, in some people who stand for long periods, blood tends to pool in the lower limbs, and this may result in varicosity of the veins, right? What causes that varicose vein? No, I'm not giving you an option. Do you know how to calculate MAP? That's mean arterial pressure. Do you? If a nurse takes your blood pressure and tells you the numbers are maybe 110/70, let me use 110/70 as an example. 110/70. So what is that person's blood pressure? Which one is systolic, which one is diastolic, what is the pulse pressure, and what is the MAP? Can you calculate all these things from just this question? These are the things you are expected to know within this discourse. One more. Let me give you one more. Let me try you one more. Can you tell me what medullary ischemic reflex is? Can you tell me? Okay, how about the blood velocity, the movement of blood? What do you think is the most important factor that affects the movement of blood? Is it the radius, like vessel radius? Is it? Is it the blood osmolarity or the hematocrit or the vessel length or the blood viscosity? Which one? So these are many other questions that we are going to discuss, all right? So I want you to pay more than usual attention as I dive into this discourse, all right? As I mentioned, try to leave any comments in the comment section below. First, I need you to look at this diagram properly. You see the ones on the red, the arteries, and the ones on the blue are the veins. It's extremely important for you to know this. You see how the heart is anchored? It's going towards the left from the midline. Very important for you to know the location and the anatomical landmark of the heart and also of the arteries and the veins. Extremely important. All these things works together. That's why I gave the illustration of the dance floor and also the dancers and the rhythm and the highway and the chill out and hangout spots. Extremely important. Remember the bouncers as well. All these things make up the circulatory system, which is what we are reviewing today. So looking at this very well, remember the anomaly I mentioned or the opposites in terms of the natural order of the arteries and the veins, what they do. If you remember, I told you in the heart, we have the pulmonary artery and the pulmonary vein that does opposites of what arteries and the vein in the systemic system does. I want you to go refer back to the video I made on the heart, and you'll be able to get this concept properly, all right? So you need to know that the arteries are high. They are called resistance vessels of the cardiovascular system. Why? Because they are very resilient. They are very strong, right? It's just like for you to drive a car on the road. That road has to be very strong. And I liken the arteries as a highway, all right? Blood moves in it very fast. Extremely important for you to know this. So it resists the pressure of the blood that is hitting on it. Just the way the car is hitting on the floor and the floor is not paving in. That's how the heart holds everything. Also, I want you to know that arteries, as a basic knowledge, arteries carries blood away from the heart, and veins, you know what, brings blood back to the heart. All right? And what are the capillaries? I told you they are the cho. Pick from this person, give this person, pick from this person, give this person. So they are in between the smallest arteries and the smallest veins. We are going to see this. You're going to do this. I need you to put on your seatbelt. Brace up. Now, before we go deep, I want us to discuss the wall. Remember, this is anatomy and physiology. What is anatomy? Location, location, location. What is physiology? Function, function, function. Fine, let me baptize anatomy. Structure, structure, structure. All right? So the structure of the blood vessel is what we are seeing here. All right? Specifically the artery. Extremely important in terms of structure. There are three natural orders rather, of the artery. We have the tunica intima, which is the interna, which is the intima, tunica media, and also tunica externa, which also can be called adventitia. It depends on the school and depends on the board exam. Some boards use tunica interna, externa. Some say adventitia. You need to know that these two things are the same thing. And if they ask you the outermost layer is the adventitia or the externa, the innermost layer is the what? Intima. The middle layer is what? The media. Now, sometimes they may be asking you, oh, which one has the smooth muscle? The smooth muscle is what? The media. It contains smooth muscle, contains collagen, it contains elastic tissue. And the outermost contains just the loose connective tissue. You understand? Because it protects the vessel, it anchors the vessel. Why the intima? Very important. What does it contain? It contains the endothelium, that's the simple squamous epithelium. Simple squamous epithelium. Very, very important. Meaning that when the blood is passing through, it is touching that intima. That's the epithelial layer. All right? And that epithelium also serves, or rather, the intima also serves as a selectively permeable membrane. And it secretes a lot of things, chemicals, and those chemicals helps for constriction and dilation. Extremely important for you to know this. All right? Now, when you are talking about the intima, this is the intima here. You see the diagram? See how the blood moves? Now, the blood touches the intima. All right? The innermost part of the intima is known as the endothelium, which is, as we discussed, a simple squamous epithelium. Simple squamous epithelium. You must know this. All right? You must know this. Now, we have the subendothelium, and also we have the internal elastic lamina, which is inside the intima. Now, when you're talking about the media, this is the media. The media is the muscular layer, all right? Just know it as media, muscular, right? Consider this, which type of muscle? Smooth muscle. Remember, smooth muscle is found in most organs, all right? We have the skeletal muscle, and we have the what? Cardiac muscle that we discussed in the heart, all right? Very important for you to know. What is the function of this medial layer, intima? It prevents rupture. It strengthens the vessel. It regulates the diameter. That's something we call vasomotion. Vasomotion, vessel motion, vessel movement. Make it make sense to you. And if you look at this adventitia, do you see this? This is the vasa vasorum. Vasa vasorum is only found in large arteries. There are literally two vessels that are found in large arteries. They are not found in small arteries. All right? Because this is the question they can ask you. They can ask you, oh, which one is found in large arteries or large veins? It's called vasa vasorum. In terms of artery, the one that is most important to us in this level is the large arteries, all right? These large arteries are also known as conducting or elastic arteries. What do they have? They have a lot of things, you know. They have the aorta, they have the, like examples of large arteries, they have the aorta, common carotid, subclavian, you know, pulmonary, common iliac. All these things are large arteries. Very important, all right? They have both internal elastic lamina and also the external elastic what? Lamina. They are known as conducting, all right? We have distributive arteries. These ones are the ones that deliver blood, but this one is the one that conducts. It gives it to the distributive, all right? Now, the major function is that it expands during systole and recoil during what? Diastole, thereby maintaining pressure and flow. Extremely important that you know this. When you are talking about blood distribution, we are talking about, oh, at a certain time, what amount of blood is contained in so and so conducting organ or vessel? What are we comparing? We're comparing the veins, the arteries, the capillaries, and also the heart. If you look at it, this is the capillaries, contains the least amount of blood at every time, followed by the heart, followed by the arteries. And the one that contains the most is what? The veins. That is the question they will ask you. They will ask you at every time, which of these vessels has the capacity to contain the largest blood? That is what? The veins. Why? Because they are thinner. They are thinner. You understand? They have less muscle, so they have more capacity. But they are thinner, they have less muscle, more capacity. All right? Also, they have elastic tissues, so they can expand easily. Very important for you to know this. Let's talk about the blood flow pathway, which I mentioned in the beginning of this discourse, all right? Normally, when blood gets to the heart, where does it go? Pump it out to the arteries. From the arteries, it goes to the smaller arteries, known as the arterioles. From there, it enters the capillaries, from the capillaries to the smaller veins, known as venules, from the venules to the veins, from veins back to the heart. This is the typical circulatory route. You must know this. You should know this. But for AP1, AP2, board exam, even for your pathology, pathophysiology, this knowledge is very, very essential. Now, there is something we call alternative blood flow routes, right? We just mentioned the normal blood flow. What if there is something that circumvents that normal blood flow? We call it alternative routes. Which alternative routes do we have in the body? Majorly the anastomosis and the portal system, all right? The anastomosis is very important. Why? Because it's found in 3 different formats. One is the arterial anastomosis, which is when 2 arteries merge. So 2 arteries merging together, right? They didn't pass the capillaries and all those things. No, they just merge together, give each other blood. Now we have the venous anastomosis. That's 2 veins. They empty into each other. Then we have the arteriovenous anastomosis. An artery directly flows into a vein, bypassing the capillaries, all right? So as far as it's bypassing the capillaries, it's known as what? Anastomosis. That's something you should know. These are the 3 forms which they will ask you in your exam. Now, when you talk about the second alternative blood flow, that is the portal system. What is the portal system? Portal system, that's when we are talking about, blood flowing into 2 consecutive capillaries. Mind you, the anastomosis, we circumvented capillary, no capillary. But portal system, 2 capillaries. Extremely important. And the most common portal system is the hepatic portal system, which is found in the intestine to the liver. Between the intestine and the liver, they have 2 capillaries, 2 capillary beds. That's why if you look at it, you see the heart to the arteries, arteries to capillary bed, then to the vein again, to the capillary bed, another vein, then back to the heart. Normally, it's supposed to be 1 capillary. You see how important capillaries is? Now, let's talk about the capillary. If you look at this diagram, I need you to focus more on this diagram than what is written here. I should have made this diagram bigger, right? Now, if you look at this diagram very well, this is the venule, the arteriole, that's a small artery. Then this is the venule, that's a small vein. First, did you notice that this moves directly to this? So blood moves from this venule to the artery direct. This channel bypassed this guy. You understand? We call this in thoroughfare channel. Thoroughfare channel. All right? Extremely important for you to know. Now, these little things that brings out blood from the arteriole, what is it called? It's called metarterioles. Metarterioles. So blood goes from metarterioles to where the capillaries, or metarterioles directly to the venules. That's thoroughfare channel. Now, this is capillary. If you see, these things are called sphincters. They are sphincters, all right? These sphincters. Very important for you to know. You understand? That's what we call precapillary sphincters, and they're very, very important. This is what they are used for, all right? So remember the capillary beds, the metarterioles, the precapillary sphincters, the thoroughfare channels. What is capillary beds? I think I didn't mention this. These capillaries, network of capillaries, more than from 10 to 100, all right? Supplied by a single arteriole or metarteriole. Very important for you to know this. Now, we have 3 major types of capillaries. If you look at this diagram, see this beautiful diagram? What do you see? You see a continuous capillary, a fenestrated capillary, a discontinuous capillary. Did you notice something? This fenestrated, it has pores. These pores are known as fenestrations. It has pores. Pause. Oh, the fact that it has pores means something is leaking out, right? That's absorption or filtration. When you talk absorption, what comes to your mind? The intestine. Yes. Fenestrated capillaries are found in the intestine. Oh, what else do you talk about? You talk about filtration. Where is filtration found? Kidney. Fenestrated capillaries are found in the kidney. So if your question comes, one of the following is found in the kidney, which one will you pick? Fenestrated. One of the following is found in the small intestine, which one will you pick? Fenestrated. Extremely important. They are important for rapid absorption or filtration. Now, what about continuous? You see, continuous looks small. Oh, small solutes like what? Glucose. Wait, glucose? No? Which part of the body needs glucose? Which tissue? All tissue. What does it mean? It means that the typical or the continuous capillary is found in almost all tissues. And what does it do? It allows passages of small solutes. Oh, we have discussed small solutes. We've discussed filtration. We've discussed absorption. What remains? What of the large solutes? Like proteins, like blood vessels. Oh, that is the work of the discontinuous, known as the sinusoids. Where are they found? Liver, bone marrow, spleen. Of course, they should be found there because that is where you see a lot of protein. That is where you see a lot of what? Blood cells. Does it make sense? At this juncture, if you've not subscribed, please subscribe. Please, if you've not liked, just go down, click like before you continue watching. Click like. All right? And also comment something. I need you to comment. Tell me what next is coming. Blood pressure. What is blood pressure? You know, when a car is moving on the highway, what is our highway? Artery, right? Car, blood, right? The tire is, moving on the, on the road. There's a friction formed or force exerted. So that force exerted is known as what? Pressure. Blood pressure. Car pressure. So when we are talking about blood pressure, we are talking about the force exerted by the blood on the walls. As it's moving like it keeps moving. That force is what we call what? Blood pressure. What is it measured with? Sphig. All right? Now, let's use 110, 170 as an example. Millimeter mercury. If a reading is 110, 70 millimeter mercury, there are a lot of things you can decipher from this reading. One, the up one is known as systole. The lesser one is known as diastole. All right? What do they mean? When you're talking about systole, loop, 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 ventricle contracting. Remember, when I was discussing about the heart, I was telling you that when ventricle contract, that's what we call systole. And that contraction, which valves closes? Think about it. It presses. It's trying to press blood forward. That means the forward valve is open. What is the forward valve? That is the semilunar valves, the aortic and the pulmonary. They open for it to press blood into it. So it means that in ventricular systole, right, that's contraction, the semilunar valves open, while the AV valves closes. And that is what we call systolic pressure. Now, the systolic pressure is actually the peak pressure, right, that occurs during that ventricular contraction. That's 110 from this example. Now, when you talk about diastolic, that's ventricular relaxation. Ventricular relaxing. Why is it relaxing? It's relaxing because you want to get blood. Where is it getting the blood from? From the arteries. Where are the atrium? Where is the atrium found? Back. So the valve at the back has to open up, and the valve in the front has to close. Which valve is the valve at the back? The AV valves. That's the tricuspid and the mitral. All right? They open up. Why that moment, ventricular relaxation, the semilunar valves closes up. Does it make sense? Yes. Okay. Now, that is out of what we are discussing. We are discussing calculation. What are the major calculations you need to know for your exam? You need to know the pulse pressure calculation and the MAP. That's mean arterial pressure. Pulse pressure is just the difference between the systole and the diastole. So for our example, it's 110 minus 70. Pulse pressure. You must not forget. Don't mistake them. But when you're talking about mean arterial pressure, you're talking about the average that driver is driving. The average pressure the blood flows through the cardiac circle. That's what we know as mean arterial pressure. Please don't confuse. It has a formula. The formula is diastole plus 1/3 of pulse pressure. Pulse pressure. So if our pulse pressure is what? Is 40. 1/3 of 40 plus 70, which is the diastole, will give us 83 millimeter mercury, which is in your exam. If you are given any question with this, you should know what you are being asked. You should know which one is systole, which one is diastole, which one is MAP calculation, and which one is pressure calculation. Now, what about if you are given a values like 110, 65? Can you calculate the mean arterial pressure? Can you calculate the pulse pressure? Do you know which one is the systole and the diastole? Yes, that's everything you have on this slide. So you can pause, look at what I did here, all right? And why is it important for you to know the mean arterial pressure? Why? Because the mean arterial pressure has a relationship, with somebody having risk for edema, syncope, arteriosclerosis, and kidney failure, and even aneurysm. All right? These are terminologies you are going to get when you are doing pathophysiology. But it's very, very important for you to know that most pathophysiology has a connection with MAP. That's why knowing the MAP is very, very important. What are the factors affecting blood flow? Listen, I'll just go straight to the point. The most powerful influence is what? Radius. Anywhere. And even when you're doing pathology or pathophysiology, remember, reduce. But what are other factors? Because I can tell you all the following factors affect, blood flow, except what are the other factors? We have flow equation. We have blood viscosity, we have the length before even the radius. But the radius is the most powerful. When you're talking about length, know that the longer the vessels, the more resistance it will have. Makes sense. When you're talking about thickness, there are things that affect thickness of blood. It can be RBC count. It can be albumin. This thing leads to thickness. So thickness is known as what? Blood viscosity. All right? And the equation tells us that F, which is the force, blood flow, is directly proportional to what? Directly proportional to the pressure and inversely proportional to what? To the resistance. It makes sense. Like this makes sense. If blood is flowing very fast, what does it mean? It means that the pressure is high. That's why they said is directly proportional to pressure. The pressure is high. If I push you with high pressure, you will move very fast. Simple. And it's inversely proportional to what? To resistance. Means that if somebody is pushing you and I stay in front of you, giving you resistance, you can't move. So the stronger the resistance, the lesser your ability to move. That's inverse proportionality. So you need to know this flow equation. You need to know viscosity. You need to know length. You need to know radius. But know that the most important of them all is what? Radius, the most powerful, which is what they will definitely ask you in your exam. And it is because of this radius that you understand why small changes in the diameter of a vessel can lead to a lot of changes in the flow. Extremely important for you to know this. Do you know why vasoconstriction and vasodilation are powerful mechanisms for redirecting blood? Do you know why, if somebody is having hypertension, we can give the person medications, that can cause vasodilation? Sometimes we give medication that can cause vasoconstriction. Do you know why? Because of the relationship between the radius and the flow. That relationship is F directly proportional to 4 of the radius, 4 power of the radius. So F is directly proportional to R raised to power 4. Very important. So what does that mean? It means that if a vessel's radius is halved, the flow will decrease by 16 times. That's 4 times 4. All right? It will decrease by what? 16 times if it is halved. Because if it's halved, that means the R is equals to 2. So 2 raised to power 4, that is 16. This explains a lot of things, and you need to know this. But the most important thing is just know that 4 power relationship and know the 16 impact of halving. If you know these two, this is the most they can ask in your exam. This is the most they can ask in your exam. When you talk about vasomotion, you are talking about changes in the blood vessel diameter, right? The blood vessel diameter, the changes, that's vasomotion, vessel motion, changes in the diameter. All right. And these changes in diameter, most times it can cause by 2 things: contraction and relaxation of the smooth muscle in the tunica media. Extremely important for you to know, because this is exactly the mechanism that allows precise control of blood distribution throughout the body. All right. What are the types? We have vasoconstriction and vasodilation, which is a term that everybody knows. Vasoconstriction, vasoconstricting. Constricting vessel. Which vessel is that? The smooth muscle found where? In the tunica media. All right. So when the smooth muscle contracts, it decreases the diameter. Contraction decreases the diameter. Dilation, increases diameter. Simple as that. What things can lead to these changes? It can be local metabolites like CO2, like hydrogen, like adenosine. It can be neural control, that's sympathetic nervous system. It can also be hormonal influences like epinephrine and angiotensin 2. All right, which we discussed a lot in urinary system. You can check my urinary video. You will get this fact well, especially the RAS system. That's the RAAS. That's renin-angiotensin-aldosterone system. Very important for you to know. Other regulation, more about the regulation of blood pressure and flow. You talk about the local regulation as auto-regulation. You talk about neural, talk about hormonal, which I discussed initially, but pouring more light on it here. When you're talking about local, you're talking about 2 major things like the metabolic theory and the vasoactive chemicals. All right. Now, the metabolic theory tells us that if there's accumulation of waste in the blood, it leads to dilation. Okay. Now, constriction can be caused by vasoactive chemicals like what? Like histamine, like bradykinin, like nitric oxide, like prostaglandin. Extremely important for you to know these examples, specific examples, because they can ask you, one of the following is a vasoactive chemical. When you're talking about neural control, you understand, you talk about the medullary vasomotor center located where? In the medulla oblongata. This is a question that comes out every time and students keep failing it. Medulla oblongata is the center for medullary vasomotor center. All right. Now, what are those medullary vasomotor centers? When you talk about baroreceptors, chemoreceptors, and medullary ischemic reflex. Baroreceptors, chemoreceptors, and medullary ischemic reflex. These 3 things are known as neural control. All right. And all of them report to the medulla oblongata, which is the medullary vasomotor center. When you're talking about hormone, I've discussed the angiotensin 2. We also have the AMP, that's the atrial natriuretic peptide. It's a vasodilator. The angiotensin is a vasoconstrictor, right? Why? Because angiotensin 2. Okay, if you cast your mind on the urinary system, if you've seen the video, if you've not seen it, please go and see it. But if you've seen the video, I told you that angiotensinogen is an inactive protein that is produced by the liver, correct? Yes. And when it's produced by the liver, then the renin is produced by the kidney. That renin will break down angiotensinogen towards angiotensin 1. Now, the lungs will produce ACE, angiotensin converting enzyme, which breaks down angiotensin 1 to angiotensin 2. Now, that angiotensin 2 does 3 important things. 1, it causes you to be thirsty. It goes to the medulla oblongata that tells you, oh, you need to be thirsty. You become thirsty and you drink a lot of water. Now, the second one is that it causes vasoconstriction. It's a vasoconstrictor. Then number 3 is that it goes to the adrenal cortex and increases the production of aldosterone. What does aldosterone do? Aldosterone will retain salt. Water follows salt, right? Thereby increasing pressure. All these things are things that help to increase blood pressure. So the vasoconstrictors are things that happen when your blood pressure is low. We want to press to increase the blood pressure. But vasodilators, the things that helps to drop the blood pressure, right? Now, like what? Like the atrial natriuretic peptide, which is the ANP, is a vasodilator. All right. Why the epinephrine and not epinephrine, they always have their variable effects. But I need you to know that angiotensin 2 is a vasoconstrictor and AMP is a vasodilator. You must know these two because the ones that are common in your exams. All right. And when you talk about medullary vasomotor center, it is the medulla oblongata. You cannot forget. Please. Now, as we've learned that the vasomotor center is in the medulla oblongata, let's talk about the baroreflex, the chemoreceptors or chemoreflex, and also the medulla ischemic reflex. Pouring little light on it so that you will know it. Baroreflex, right, responds to pressure. Chemoreflex responds to chemical. What are those chemicals? We're talking about oxygen, CO2, pH. That's acidosis, alkalinity. When it is too acidic, blood is too acidic, chemoreceptors are triggered. When it is too alkaline, chemoreceptors are triggered. And chemoreceptors detected in the carotid and the aortic bodies. Very important for you to know. The carotid and the aortic bodies. When you're talking about baroreflex is, for pressure. It adjusts the heart rate and the peripheral resistance. All right? Specifically. Where is it found? Carotid sinus and aortic arc. Carotid sinus and what? Aortic arc. But the other one is carotid and aortic bodies. Baroreflex, carotid sinus and aortic arc. You can't fail this. You can't forget this. I don't want you to misplace it. So sing it a lot of times in your head. When you're talking about medullary ischemic reflex, it's just how the brain responds to blood flow. When blood flow is compromised in the brain, everything in your body, vasoconstriction triggers because the brain is extremely important. So medullary ischemic reflex talked about the brain, the medulla oblongata specifically. All right. So immediately there is a blood flow to the brain is compromised. It triggers widespread vasoconstriction, and what happens immediately? Blood pressure rises. Why does blood pressure rise? It rises because it wants to restore the perfusion of blood to the brain. Extremely important. Extremely important. For hormonal control of blood pressure, I don't even know this slide is here. We have the things you need to know, like the peptide, AMP, atrial natriuretic peptide, angiotensin 2, which I've already discussed, the antidiuretic hormone, the aldosterone, which I've also discussed. The antidiuretic hormone is another name for it is vasopressin. It's produced in the hypothalamus and stored in the posterior pituitary. Extremely important that you know it. And what does it do? Promotes water retention. When is it produced? It's usually when blood pressure is low. That's vasoconstrictor. You understand? It helps in vasoconstricting. Blood pressure is low, it retains water. You understand? Low water in the blood means low blood pressure is low. It's as simple as that, right? Why ANP decreases blood pressure? How? It promotes sodium excretion. And what happens sodium excretion? Water follows sodium. Means water is too much. High blood pressure, water is too much. We want to reduce water. ANP, it pushes out sodium. Water follows sodium. Water drops in the blood. Blood pressure drops. So it's a vasodilator. All right, so you just need to know what each of these things do. You learn more of it in AP2, but if you check my video, I've done a video on AP2 hormone. I want you to look at it when you are doing your AP2, or for people that are writing their NCLEX immediately, or their other boards exam immediately. Go and check that video. If you look at this diagram, this is the renin angiotensin aldosterone system. You see what I told you, the liver produces angiotensinogen, the kidney produces renin angiotensinogen to angiotensin 1. Angiotensin 1 comes down here, the ACE from the lungs, that's angiotensin converting enzyme, breaks down angiotensin 1 into angiotensin 2. What does angiotensin 2 do? First, it goes to the brain to cause tears, all right? The hypothalamus it goes to the brain to cause tears, right? Then it directly goes to the blood vessels to cause vasoconstriction, right? Then what else does it do? It goes to the adrenal cortex to cause what? Aldosterone production. This is exactly what I've discussed. The aldosterone will now cause water retention, leading to absorption of water, sodium retention, leading to absorption of water. Very important for you to learn this. You understand? But majorly, you should just know these little information about it when you get to your AP2. For people that are doing AP1 currently, do AP2 and you learn more about hormones. Now, going back to capillary exchange, what is the purpose? I told you capillary, chom, collect from this person, give this person, collect from this person, give this person, take from here, give here, take from here, give here. That's what the capillary is. It's the business end of the circulatory system or cardiovascular system. Extremely important that you know it. All right. In which ways does it work? The diffusion, transcytosis, filtration, reabsorption. You need to know the differences between these things. When you talk about diffusion, it's very important mechanism for most substances moving from here to here. All right. When you talk about transcytosis, transport across endothelial cells via vesicles. That's transport across. That's transcytosis. When you're talking about filtration, it's just movement of fluid out of the capillaries due to hydrostatic pressure. When you're talking about reabsorption, you're talking about, into the capillaries due to osmotic pressure. So into reabsorption, reabsorb into the capillaries by what? Osmotic pressure. Osmotic pressure, albumin, and all those things. Filtration is of the capillaries through what? Hydrostatic pressure. Filtration works with hydrostatic pressure. Reabsorption works with what? Osmotic pressure. All right? So the balance between filtration and reabsorption determines net fluid flow. Simple. So that's the balance between hydrostatic pressure and osmotic oncotic pressure. Extremely important that you know this. Another concept you need to know is the edema. What causes edema? Three things. One, increased capillary filtration can cause edema. Two, reduced capillary absorption. Three, obstructed lymphatic drainage. There are different diseases that can cause these things. Like obstructed lymphatic drainage can be elephantiasis, that's parasitic infections, like blocking the lymph nodes, all right? And also, when you remove the lymph node, it becomes swollen. That's obstructive lymphatic drainage. Also, increased capillary pressure can be as a result of high blood pressure. That's why you see people with high blood pressure having swollen ankles, swollen legs, swollen feet, swollen hands sometimes. And also, people that has liver disease, protein malnutrition, all those things, that they have reduced capillary absorption. Very important for you to know. Now, when you're talking about edema, edema is just accumulation of excess fluid in tissues. When more fluid filters, then it's reabsorbed. All right? There are a lot of things that could lead to edema, as we mentioned initially. All right? Impaired function, necrosis, shock. So edema is pathology. Usually don't come out in most physiology exams, except if it's pathophysiology. All right? But you need to know this information. At least you need to know that things that could lead to edema is increased capillary filtration, reduced capillary absorption, and obstructive lymphatic drainage. They may ask you, one of the following does not lead to edema, or one of the following is a cause of edema. You should be able to know, even if they don't test you on specific diseases. Now, when you are talking about venous return, you see, it's when blood flows back to the heart, right? It's very, very important because we need blood to flow to the heart, to maintain cardiac output, correct? Yes. Remember the formula for cardiac output. If you don't know it, go to my other video and check, all right? Now, for the veins of venous, we have pressure is just 12 to 18 mmHg. For the heart, it's just 5 mmHg. So you see, pressure is low in all these areas, all right? Unlike the arteries. Other things that could assist venous return is like gravity, assist drainage from the head downwards. Gravity will push down, all right? Gravity does not affect the ones that's coming up, nah. All right, then we have skeletal muscle pump, is the one that squeezes blood to the heart. We have venous valves, prevents backflow. So when blood passes, it closes. You remember with the bouncers, right? Then you also have the thoracic pump, which is when you breathe. So breathing creates pressure that leads to venous return. So you need to know what are the things that lead to venous return: gravity, skeletal muscle pump, venous valves, and thoracic pump. These four, they can tell you one of the following is not in support of venous return, or one of the following does not lead to venous return or assist venous return, anything. When you talk about varicosity of vein, right? If you look at this picture, look at this diagram, this is normal. See, this is where the vein is. You see this person's leg, you can't even see the vein, right? This is how the vein is. This is the valves. You see the valves? Vein go up, blood go up, it closes, it closes. This is normal. This is the valves. Now look at this varicose patient with the varicose vein. You see, if you look at the leg, you see twisting. All right. Now this twisting, what leads to this twisting? Look at, you see the valves out of place. So blood is flowing backwards. You see this arrow? Because of the fact that this valve is bad, blood is flowing backwards. Before you know it, what will it cause? It will cause distension. That distension is what you see here as varicosity. Very, very important for you to know. So varicosity is caused by backflow of blood, right? So backflow further distends vessels, right? Weakens the valves and leads to varicosity of vein. It's very, very important. So pooling of blood, valvular problem, all these things lead to varicosity of vein. So you need to know what we mean by varicose vein and how it causes. This thing is more common in people who stand for long periods. Why? Because if you stand for a long period, blood will pool in your legs. And when blood pools in your legs, it creates high pressure for the valves, which is not supposed to be. When you create high pressure for these valves, right, the valves will start what? Distending. And this distension, when it continues with time, it leads to what? Varicosity. Now, when we talk about shock, shock is a circulatory shock, or shock itself is just any life-threatening condition that will lead to, inability of blood, getting into tissues. That's what shock is. There are different types of shock. We have cardiogenic, we have the hypovolemic, we have the septic shock, we have neurogenic shock, a lot of other shocks that you have. So circulatory shock specifically is any state where cardiac output is insufficient to meet metabolic needs. So the body as a whole is not getting enough blood. And if it's not getting enough blood, that means it's not getting enough oxygen. It's not getting enough nutrients. All right, that is what we call circulatory shock. Some of the circulatory shock, we have the cardiogenic shock. In cardiogenic, cardiogenesis, heart genesis starts from the heart. Means that there is inadequate pumping in the heart. That inadequate pumping will lead to myocardial infarction or probably caused by infarction. All right, that's cardiogenic shock. The problem is from the heart. When you talk about hypovolemic shock, you are saying that, there is less blood in the system. The person has lost blood. Blood volume is too reduced, too small. It can be as a result of hemorrhage. It can be as a result of burns. It can be as a result of dehydration, right? So the blood is no longer sufficient. So even as much as it comes to the heart is working fine, but blood is not sufficient. That is hypovolemic shock, all right? Now, when you talk about septic shock is talking about toxins from bacteria. Bacteria will give toxins. It will trigger vasodilation. The vessels will swell like this, will stretch like this. So blood, there will be more pooling of blood. So the blood will not be going back to the heart as it should go back to the heart. All right. And when you talk about neurogenic shock, you're talking about loss of vasomotor tone. All right. Remember, normally the vasomotor how vessel is moving, is controlled, by the brain. When there is a problem, maybe for example, a spinal cord injury, it will lead to neurogenic shock. And because of that, blood will not be able to return. All right. Sometimes we have obstructive venous return shock, like, physically the veins are blocked. Also we have venous pooling shock, that's vascular shock. When there's widespread vasodilation, all these things, types of shock. But know that shock is when there's not enough blood going to the rest of the body or going back to the heart. Extremely important for you to know this. These are the things, these are the types. You need to know each of them. These are just salient information. You know about them when you do pathophysiology. But for now, remember we are doing physiology, which is function, and anatomy, which is location, structure. Now, in the beginning of this discourse, I mentioned the portal system. Just know, there is no big deal. If you look at this chart, this is heart, artery, arterio. What do you have next? You should have capillary. From capillary, you should have what? Venous, then the vein, then the heart. But instead, what do you have? You have the heart, artery, arterio, first capillary bed, portal vein, second capillary bed, then the venous, veins to the heart. Doesn't make sense. Why? Because there are two capillaries here. There should not be. But this is what we know as the portal system. It's as simple as that. Anastomosis is when you don't even see capillary. But when there are two capillaries, there is a consecutive capillaries, that is portal system. All right? Now, there are different types of portal system. We have the hepatic portal system, which I mentioned initially, the most important, intestines to the liver. We have the hypophyseal portal system, hypothalamus to the anterior pituitary, because they have a lot of relationship. Hypothalamus, for example, produces 8 hormones. 6 goes to the anterior pituitary, which triggers the anterior pituitary to produce its own hormone. Then the other 2 stores in the posterior pituitary. So that relationship between the hypothalamus and the anterior pituitary, there is a hypophyseal portal system there. Now we have the renal portal system, which is found within the kidney. These are the 3 portal systems. You should know the examples. Simple. You should know what portal system is about. All right? Consecutive capillary network. It should not be overstated. As a summary of cardiovascular system, you should be able to know the vessel structures, the blood pressure, how to calculate it, especially the MAP and the pulse pressure difference. You should be able to know about the resistance, the controls, especially by the vessel that reduce, the capillary exchange, which balances the hydrostatic pressure and the osmotic forces. Right? When you understand this concept, it will help you to have that understanding, comprehension, both the normal function, which is the physiology, the anatomy as well, like the normal anatomy, and also the pathological conditions when you are doing pathophysiology. All right. Also, more for you to know, you need to know more about the flow regulations, know about the venous returns, flow regulation. Remember, we discussed the local, the neural, the hormonal. Know about the venous returns, which we discussed multiple mechanisms, including valves and pumps. Also know about specialized circuits, which is the pulmonary, the cerebral, and the portal systems. Right? This will aid your understanding of the cardiovascular system very, very, very well, and be able to attempt any question from the CVS. As far as it's CVS, physiology. So now we will, discuss one or two questions before we round up. We've already discussed a whole lot of questions. I hope you are taking notes when I was saying those questions. There are a whole lot of other questions I want us to look at before I end this discourse. We are going to recap with some of these questions. For example, if you're asked, artery is sometimes called what? This is one of the questions they're always asking. They are sometimes called what because of their strong resistance tissue structure. It's always called what? Resistance what? Vessels. Resistance vessels. Not capacitance, not distance, not that stance, but resistance vessels. Extremely important that you know this. Now, some questions we ask you, which vessels has the biggest media? It's large arteries. Large arteries. You understand? If you look at this is the tunica media, right? Containing the smooth muscle. The large artery has the thickest, all right? And also, the large arteries has what? Vasovasorum. Large arteries and veins, they have what? Vasovasorum. Vasovasorum. Always remember this. These are questions that they are always repeating. I've already mentioned this, but this is more like a recap, all right? These vasovasorum are just small vessels that supply blood to the outer wall. Because they are those large arteries and veins, they are big, they need something to supply them. Those are the vasovasorum, not found in small ones. All right? But when they are talking about middle, that tunica media, which one has the biggest? It is large arteries, not large veins, large arteries. And also, remember that we compared the veins, the arteries, the capillaries, the heart, in terms of which one has the greatest volume of blood, and we say that the greatest volume of blood is found where? In the veins. So if you see a question on this, don't forget. Just a recap. Remember the concept, because some exams can ask you which one has the smallest volume of blood. That is the capillaries. You see on red, capillaries. Now, when you talk about alternative blood flows, remember anastomosis, remember the portal system. All right. So in the option, you can see anastomosis, please pick it. If you see portal system, please pick it. Also, remember for the portal veins, you can be asked a question in different dimensions. For example, I can tell you, oh, look at this. I can draw exactly this: heart to arteries to capillary to vein to capillary to veins to heart. It is left for you to determine that, oh, this is portal system. He's talking about portal system. And if you're asked, is the portal system in the heart? Is it in the heart? No. All right. No, the major place is in the body, is the intestine to the liver and the other places we discussed. But is it in the heart? No. So if they say, oh, which of the following is not in the heart? You look for, if you see capillary, you know that is the answer. You move on. There are a lot of ways they can ask you this particular question. Anastomosis and portal system. So you need to be aware. You need to be awake. And you need to know what you're doing. And you need to remember that physiology is what? Function. They can ask you a question on vasomotion. Anything can be asked on vasomotion. One of the things could be smooth muscle in the vasomotion, right? They can tell you which one specifically helps in vasomotion. It is the smooth muscle, all right? They can ask you types of vasomotion, vasoconstriction, vasodilation. They can ask you controls of vasomotion, local controls, neural controls, and hormonal influences. These are the things you should know about vasomotion. Most importantly, know that it is the smooth muscle in where the tunica media, smooth muscle in the tunica media that controls vasomotion. This is the best information you have to grab out of this entire slide. What did we say is varicose vein again? Can you remember? Remember we said that there are some people that stand for a long period of times, right? What happens to them? Blood tends to pool in the lower limbs. So this pooling, you understand, stretches the veins, right? And when it stretches the veins and enlarges the veins, it leads to what? Weakening of the valves. So the failure or the weakening, look at it, valvular failure. The failure or the valvular, the failure of the venous valves leads to what? Varicosity. So I need you to pay attention when you're answering this question so that they don't throw you off balance, because usually in the option, there are a lot of things that are very similar. But when you get the concept that, oh, varicosity is as a result of failure of the venous valves, then you are good to know. Go. All right? Sometimes it can be distension of the venous valves. All these things are the same thing. Weakness, distension, failure. All of them are the same thing. But you should know that they are talking about the venous valves. This is extremely important information for you. Also, you need to understand blood pressure calculation. When you know which one is systole, know which one is diastole, know that the difference between the two of them is the pulse pressure. Know that this pulse pressure, if you divide it by 3 and add it to the diastole, you are getting what's the mean arterial pressure. Any number they give you should be able to know. You should practice this. Sing it in your mind. Sing it in your head, so that you don't fail a question from it. Because in all the exams, AP1, AP2 exams, there's always 2 to 3 questions on this. It's a giveaway. It's something you cannot afford to fail, to get rather. Don't mind me. Now, you need to know the factors affecting blood flow, which is the viscosity, the length, and the radius. All right. We said that the most powerful influence is what? The radius. Always remember this. And what does blood viscosity do? What does viscosity do? When there is increased viscosity, it slows the rate of blood movement, right? It slows the rate of blood movement. So the increased viscosity slows the rate of blood movement. But the most powerful influence is what? Venous vessel radius. These two things you should know. Increased viscosity slows the rate of blood movement or blood flow. But what is the most powerful influence? Venous vessel radius. There are more than 2 or 3 questions you are going to see these things on. They'll be testing you to know if you know what increased blood viscosity does and if you know what radius does. And remember, the radius we say is F raised to power F, that's flow, directly proportional to radius by 4, R raised to power 4, right? If you have radius, you get 16. If you have radius, you get 16 times flow decrease. That's what I was trying to say. You get 16 times flow decrease, all right? Extremely important for you to know this relationship. Now, we have the barrel reflex, we have the chemoreflex, we have the medullary ischemic reflex. They can ask you, what does barrel reflex lead to? Remember, barrel reflex responds to blood pressure. Chemoreflex responds to acid, O2, CO2, pH, that's acid and bases. Why medullary ischemic reflex, which is one of the most important? It responds to what? Brain blood flow compromise. So immediately the blood brain flow is compromised. What happens? It restores it. It raises it up. It increases it. So it increases circulation to where? The brain. So when you hear medullary ischemic reflex, that's increase, trying to increase blood flow to the brain. And remember where I told you that is the vasomotor center of the brain? That is the medulla oblongata. It's something you cannot forget. And if I ask you which one is one of the powerful vasodilators, they are one of the powerful, look at it here. One of the powerful vasodilators are AMP. One of the powerful vasoconstrictors are the angiotensin II. You have to know these ones, at least. Also remember that norepinephrine is a vasoconstrictor. So if they give you, which one is the powerful vasoconstrictors? Angiotensin II, norepinephrine. Both of them are the same vasoconstrictors, all right? But remember, nitritic peptide, it can be nitritic peptides, it can be arterial nitritic peptide, AMP, vasodilator. Also remember which ones moves across the wall, vessel wall. We talk about diffusion, talk about transcytosis, talk about filtration, talk about reabsorption. Anyone outside this does not lead to capillary exchange, please. And also, when you are talking about the arterial end, what drives filtration is the blood hydrostatic pressure. Please. When you are talking about that, the forces of capillary exchange, I don't think I discussed this slide, I jumped this slide, but just know that you have the arterial end, you have the venous end. In the arterial end, what drives filtration is what? Blood hydrostatic pressure. Remember it. Remember it. Remember the things that could lead to either increased capillary filtration, reduced capillary absorption, obstructive lymphatic drainage. Extremely important for you to know this. Remember shock. I mentioned about shock, which is anything that will reduce blood flow to the tissues and to the heart. All right. So what are some of those things? I've mentioned types of shock: cardiogenic, hypovolemic, and neurogenic, septic. Most important ones, the hypovolemic. Remember, hypovolemic has to do with blood loss. Blood loss, hypovolemic, blood loss, hemorrhage, hypovolemic, dehydration, hypovolemic, burns, hypovolemic. Bacterial toxins, septic. Sepsis is infection. Bacterial toxic sepsis. Bacterial toxins, sepsis. Don't forget. When you are talking about myocardial infarction, it can lead to what? Cardiogenic shock. So if you can remember at least these 3, it's okay for you. The neurogenic, you will know that it's anything that does with the neuro, that's spinal cord and the brain. But cardiogenic, myocardial infarction, heart. Hypovolemic, blood loss, hemorrhage, burns, dehydration. Sepsis, bacterial toxins. If you know this, you are good to go. If a soldier stands for a long time and suddenly is having syncope, trying to little fainting spells, what do you think happens? Standing for a long period of time. Did you see what I mentioned here? That is called blood pooling. A lot of blood has pulled downwards. Few is now going to the head. You start having syncope. And this also leads to what? Varicosity of vein. So remember, blood pooling. All right? When you stand for too long, it can lead to syncope, and also it can lead to what? Varicosity of vein, varicose vein. Please remember this portal pathway. Extremely important for you to remember this portal pathway. All right. In portal systems, if I can remember hepatic portal system, that's enough, which is in intestine to the liver. These other ones are not very important for me and for most of your, this level exams. All right. So hepatic portal system is extremely important in intestine and also in the liver. Remember this. Remember that it's first capillary and the second capillary for it to be a portal system. Remember anastomosis, there is no capillary. Remember the summary I mentioned: vessel structure, resistance, blood pressure, capillary exchange, flow regulation, venous return, specialized circuits. All these things are extremely important for you to digest and for you to understand blood cells. I appreciate the fact that you watched this video from beginning to ending. Please don't forget to like, don't forget to subscribe, and also don't forget to comment. These things are extremely important, all right? So take your time, look at this video 2, 3, 4, 5 times before your exam. It will really help you in passing any exam as far as it's A1, AP1, AP2, and also your board exams like NCLEX, like US. This discussion is extremely important. It comes handy. All right? Thank you very much. Have a nice one.